Prostate cancer, of course, is one of the most important diseases for urologists, and advanced prostate cancer is becoming more and more common because people survive the early stages of disease and then they need treatment. And chemotherapy for those stages is standard. Immunotherapy is one of the emerging hopes for the future. We have the first trials to report. In chemotherapy, we don't have new drugs. It is docetaxel and the new cabitaxel, which exists for a couple of years, which are standard of care. But we have a new group of patients, those who have an initial diagnosis of metastatic prostate cancer, and those who have a high burden of disease are better treated in the combination of hormonal therapy, which used to be the standard before that, in combination with docetaxel. They have a high survival benefit for them. So that is standard, that is exciting for us. For the rest, it is still going to be the standard. Progress in the area is that we have learned how to handle these drugs, and we use now, for instance, for the docetaxel, 2-weekly schematics, same for the cabitaxel. We have other regimens, but in different dosage, and it improves tolerability and still maintains the efficacy. Now, when it comes to immunotherapy, that is very exciting because we had for a couple of years in vaccine, which is licensed in Europe but not available and quite expensive. And now we've got a new group of drugs which are called the checkpoint inhibitors. Now, let's put it this way. The first couple of trials which were done with the CTLA-4 inhibitors, Immunolab, was in second line and in first line, not a positive. We had a trend, but not the significance. Now with the new drugs we have, the PD-1 inhibitors, it looks much better. And we are testing combinations of drugs, and in particular in a subgroup of patients who originally responded to hormonal therapy and became progressive. When you add PD-1 inhibitors, they have even complete remissions, which is quite exciting for us.